All right, I would just like to make a few last points here. Um, Healthcare has inelastic demand, which means even if the price changes, you still kind of need it. I really like this scale. It shows you a bit of some alternative things that you could compare it to. Take a look down here at fresh tomatoes. This has a negative elasticity and a pretty large one, and that's because fresh tomatoes have a lot of substitutes. If the prices go up on fresh tomatoes, you can find something else. You can find some other kind of fresh food. You could find frozen tomatoes, lots of alternatives. And so if prices get jacked up on fresh tomatoes, you have somewhere else to go. Down here on the other end, take a look at salt. So salt is mighty inelastic because there's not much you can do. If you've got a recipe that calls for salt, you're probably going to have to get some salt. Maybe you can substitute for some other spices in certain scenarios, but for the most part, even if the price of salt were to increase, you do need it for lots of things. So healthcare, whether that's inpatient, dental, outpatient, emergency care, et cetera, is inelastic, which means that there's not that much price sensitivity to healthcare. And that's helpful as we think about changes in prices and total spending. If we see increases in prices, it seems likely to have some effect, but not an enormous one, on how much care we choose to get. So one important question is, does the price for care affect health? We know that it affects healthcare utilization, but healthcare utilization is not quite the same thing as actual health status, how healthy a patient is. So in the RAND health insurance experiment, they found that there was really no difference between these treatment groups. They did have a 10% difference of mortality rate between high-risk participants on free and cost-sharing plans. The people in the free plan were less likely to die. That's specific to a sort of a narrow range of the population. So in terms of averages, it didn't seem to have that much effect. And similarly, in the Oregon Medicaid experiment, there was not a difference in health status between the lottery winners and the lottery losers. So if you take a look, here's some details of the RAND health insurance experiment. So they compare those who were on this free plan where care was free to those who were on the copay plan where there was a marginal cost associated with their care. And there was really surprisingly little difference in these indicators of health status. A little bit of difference on this diastolic blood pressure, for example, marginal significance there. A little bit of difference on functional near vision. To be honest with you, I don't know what Snellen lines are, but they are a measure of vision acuity. And so they look to be a little bit higher in this copay plan. That actually doesn't really make that much sense. So it's almost a little bit surprising, I guess, that the price for care doesn't necessarily affect health that much. I think it speaks to the fact that health services do translate to health, but not necessarily on a one-to-one or obvious basis. So, excuse me, in the Oregon Medicaid experiment, the lottery winners did self-report a few things that it's useful to collect some self-report data in addition to just the sort of hard numbers like on the slide I just showed you. So they self-reported some better overall health, more healthy days, and lower rates of depression. One possible explanation for that in terms of the differences between the RAND health insurance experiment and the Oregon Medicaid study would be a slightly different type of population. Obviously, a Medicaid expansion is going to be targeted mostly to low-income communities. RAND health insurance experiment was a broader cross section of the United States. So I thought that was interesting. When the first time I read the Oregon Medicaid experiment paper, I thought it was really interesting that these measures of health didn't change that much, but there were some indicators of mental health that seemed to be at least self-reported mental health that seemed to be better, and I think that is worth thinking about. And what is the role of insurance? Health insurance obviously gives you access to care. but social insurance more generally may have additional benefits. So if you are living a life without any insurance, and you know that if you were to be in an accident or to get sick through no fault of your own, if suddenly that would put you on a path towards a lot of high spending care, you go to the emergency department, $20,000 or $30,000 later, you know that that kind of thing is going to be financially catastrophic for you. And if you have insurance, even if it doesn't get you a lot of increases in health, it may offer a financial security that does improve your mental health. We know from studies that poverty is associated with very high levels of stress. Stress is very bad for the body, so you could also imagine longer term consequences as well. So health insurance does get you access to health most of the time, but it may also get you access to financial security in a way that that could be welfare improving for the population. So that, I think that's something to think about. So just to wrap up here, demand curves for healthcare are indeed downward sloping, which is great. It means that health economists everywhere can sleep at night. And that means that the quantity of care demanded is somewhat sensitive to the price that is charged for health services. That being said, there seem to be limits to the relationship between the price of healthcare and health itself. So, as I noted, one of these exceptions is that price does seem to affect the most vulnerable segments of the population in certain ways, at least in certain measures of health, for example, high blood pressure. So, as far as policy and health insurance implications go, I think that those are some things that are worth thinking about, as I mentioned on the previous slide, with respect to what is the purpose of health insurance? Is it to, if you gave everyone really, really comprehensive health insurance, would it automatically make the entire population a lot healthier? Probably not. That's probably not the argument that you would want to make. But you could certainly make arguments about its effects on the well-being of patients in a more holistic sense. And there's certainly a lot to be said with respect to equity concerns, and spreading health insurance to everyone may be a more equitable way to allocate resources from the healthcare sector. So that's it for now, and thank you very much.